Hi everyone, welcome back to my channel. Today we will discuss anatomy of uterus. We will cover the following objectives: its introduction, shape and size, location and associated organs, anatomical positions, anatomical parts, structural layers, and brief overview of its blood supply, nerve supply, and lymphatic drainage. Uterus is the hollow muscular organ present inside the female pelvis. It is the main reproductive site for menstruation, implantation of fertilized ovum, and nurturing site for developing fetus during pregnancy in female. It is inverted pear-shaped organ. It is about 7.5 centimeter long, 5 centimeter wide, 2.5 centimeter thick, and weighs between 30 and 40 grams. It is located in midline of female pelvis between the urinary bladder and rectum. This is anterior side of uterus and this is posterior side of uterus. So when we talk about its anatomical relations or associated organs, then anteriorly, uterus is present behind the urinary bladder. Here, peritoneal pouch is formed between the anterior side of uterus and urinary bladder, that is known as vesico-uterine pouch. Posteriorly, uterus is present in front of rectum. Again, peritoneal pouch is formed there between the posterior side of uterus and rectum, known as recto-uterine pouch or pouch of Douglas. Laterally, uterus is connected to the fallopian tubes. Inferiorly, its lowest segment, that is known as cervix, directly opens into the vagina. When we talk about its anatomical position in the female pelvis, then there are two most common positions, that are antevarian and anteflexion. Antevarian describes the angle between the cervix and the vagina. In this position, uterus is tilted forward at towards the uterine body. Anteflexion describes the angle between the uterine body and cervix. In this position, uterus is bent forward towards the urinary bladder. While these two positions are most common, but roughly 20 to 25% of women show some variations that are also normal and asymptomatic. These variations can be retrovariant. In this position, uterus is tilted backward at the rectum. Retroflexion. In this position, uterus is bent backward at the cervix. There are four anatomical parts of the uterus. This uppermost and dome-shaped section of the uterus is fundus, and it lies above the opening of fallopian tubes. This central and largest section is body, also known as corpus. It contains the uterine cavity. It is the site of implantation and fetal development. Isthmus is the narrow, constricted section of the uterus of about 1 centimeter long. It forms the lower uterine segment during pregnancy. It is the common site of C-section in CN. Cervix is the lowest cylindrical part of the uterus. It connects the uterus to the vagina. It has two anatomical parts based on its relation to the vagina. Supravaginal part, that is above the vagina, vaginal part that projects into the vagina. Cervix has two openings: internal OS that opens into the uterus and external OS that opens into the vagina. Structural layers of uterus. When we take the cross-sectional part of uterus, then we found three layers of tissues in uterine wall. These layer of tissues are perimetrium, myometrium, and endometrium. Perimetrium is the most outermost layer. It is serous layer, that is the part of peritoneum. Perimetrium covers the outer surface of uterus. It provides protection and reduces friction between the uterus and surrounding organs. Myometrium is the middle and thickest layer of the uterus. It is made up of smooth muscle fibers interlaced with areolar tissue, blood vessels, and nerves. This is the layer that is responsible for menstrual cramps during menstruation and powerful contraction during labor. Endometrium is the innermost layer. It is made up of columnar epithelium covering the layer of connective tissue. It contains mucus secreting endometrial glands. It is richly supplied with blood by uterine artery. Endometrium has two functional layers, that are functional layer and basal layer. Functional layer is the upper layer. It thickens and becomes rich in blood during the mid of menstrual cycle to prepare the uterus for implantation of fertilized ovum. If ovum is not fertilized, then this functional layer is shed during menstruation. Basal layer lies next to the myometrium and is not lost during menstruation. It is the layer from which the fresh functional layer is made during each cycle. Blood supply to the uterus. Arterial supply is by uterine artery, that is the branch of internal iliac arteries. This artery supply the uterus and uterine tubes, then join the ovarian artery to supply the ovaries. Venous drainage is by uterine venous plexus. These veins follow the same route as uterine artery and drain into the internal iliac vein. Lymph drainage. Deep and superficial lymph vessels drain lymph from the uterus and uterine tubes into the aortic lymph nodes and other nodes associated with iliac blood vessels. Nerve supply. Nerve supply to the uterus and uterine tubes consist of parasympathetic fiber from the sacral outflow and sympathetic fiber from the lumbar outflow. Let's summarize the whole lecture. Uterus is the hollow, muscular, inverted, pear-shaped organ present inside the female pelvis. It is the main reproductive site for menstruation, implantation of fertilized ovum, and developing site for fetus during pregnancy in female. It is located in between the urinary bladder and rectum in the female pelvis. Main anatomical positions of uterus in female are antivarian and anteflexion. But some female also show variations that are also normal and asymptomatic. These variations are retrovarian and retroflexion. There are four main anatomical parts of uterus, that are uppermost dome-shaped fundus, main central portion, that is body, narrow constricted region between the uterus and cervix, that is isthmus, and the lowest part, that is cervix. There are three layers of tissues in uterine wall, that are perimetrium, that is the outermost layer, myometrium, middle layer, and endometrium, that is the innermost layer. Blood supply to the uterus is by uterine artery, and venous drainage is by uterine venous plexus that drain into the internal iliac vein. If you found my video helpful, then kindly subscribe, like, and share my channel. Thank you for watching.